r/coronavirus posted by u/WebMD. We are a team of medical experts following COVID-19's progression closely. Ask us anything. News about the coronavirus outbreak that started in Wuhan, China, is changing rapidly. Our team of experts are here to break down what we know and how you can stay safe. Answering questions today are Neha Pathak, MD, DipABLM. Hans Bargava, MD. Brenda Goodman, reporter. Michael Mina, MD, PhD. Isaac Bogok, MD, SM, FRCPC. More about Carlos Del Rio, MD. More on WebMD's coronavirus coverage. I keep hearing that lots of people are having mild symptoms, but exactly how mild are mild symptoms? Like, are we talking a bad cold or are we talking sniffles for a few days? We are learning more and more about the full spectrum of illness rapidly. Some people are truly asymptomatic, they test positive and are infected with the virus, but really have no symptoms at all. There are a few examples of this. I like this one, where 2 out of 114 people who returned from Germany from Wuhan were found to have the infection, but they did not have symptoms. Of course, we also know that some have very severe symptoms, require intensive care unit care and sadly succumb to their illness. Then there is a large spectrum of illness in between. The interesting thing is that as we see diagnostic testing rolled out, for example South Korea, there is a growing appreciation that mild symptoms are actually rather common. Currently the estimates are that about 80% of people will have a milder course of illness, but I think as we learn more about the infection this proportion may grow a bit. What does a mild infection look like? Perhaps a low-grade fever and a mild cough for a few days. Currently, in many countries, people with mild symptoms are still being diagnosed in a hospital setting and then getting sent home as there is no reason to keep them in hospital, they clinically well enough to recover at home. Some regions, for example UK, South Korea, are scaling up diagnostic testing outside of hospitals to 1. Provide great care in an outpatient setting, 2. Prevent overcrowding of their emergency departments. Isaac Bogok, MD. I watched Dr. Aylward's press conference from a couple weeks ago and at one point I think he suggested about half of the mild cases are people who get pneumonia but aren't in severe enough condition to require hospitalization. Did I understand that correctly or does that appear to be accurate? We are learning more about this virus and the spectrum of illness it causes rather quickly. We only learned of the existence of COVID-19 infections about 3 months ago. We do not have all the answers and must remain humble. Still, there is a growing understanding that a significant proportion of people will have mild symptoms with this infection. Many will not require hospitalization, and in fact, many don't even consider this infection or seek medical care, possibly contributing to community transmission in some settings. The symptoms tend to be fever and cough, but some will have more severe manifestations than others. Remember that all pneumonia means is an infection in the lung, it does not tell you how severe a particular case is. Fortunately most seem to do well with this infection and recover quickly. But sadly, there are still a small, but significant, proportion of people who fare worse, require hospitalization, and succumb to their illness. Isaac Bogok, MD. The spectrum of disease still being defined but till 80% of people have mild disease and around 20% moderate to severe disease that requires hospitalization. Dr. Carlos Del Rio. How does it spread? How far? Does it live on the surface? Has it mutated several times now? What is the progress on the vaccine? What is the best way to protect yourself other than washing hands? It spreads from person to person through respiratory droplets, tiny drops of mucus that spray into the air when we cough or sneeze. The virus has also been detected in stool, and there's been some evidence that it may be spread through fecal-oral contamination, which is a clinical way of saying the germs get on our hands or other surfaces after we go to the bathroom that then make it to our mouths. It can live on surfaces for several hours. We don't know exactly how long yet. We don't know about mutation of this particular virus yet, but in general, coronaviruses don't mutate very easily. They contain a unique mechanism called a proofreader that corrects errors in their genetic sequence. That ensures that they will continue to copy themselves correctly each time. It also means they are slow to mutate. The latest news about a vaccine is that there is a candidate vaccine that is ready to test, but it must go through clinical trials in order to ensure that it is both safe and effective. Those studies will take some time. Dr. Fauci at NIH says 12 to 18 months at minimum for those studies. Hand washing is a powerful way to protect yourself and others. Staying away from people who are sick and avoiding crowds are two more. Brenda Goodman. Obviously hand washing is superior. However, does sanitizer help when used from time to time? Alcohol-based hand sanitizers are your best bet if you can't get to soap and water. You want to look for those made with at least 60% alcohol because these tend to be the most effective according to the CDC. Check the label. Ethyl alcohol, ethanol, isopropanol or N-propanol are all fine to use. Even some natural sanitizers are made with the correct percent of alcohol and are safe to use. Remember, it's not just about what it's made from but how you use it. So make sure you read the instructions and cover all parts of your hands. Between the fingers and under the nails are some of the spots people forget. Neha Pathak, MD. What is the long-term prognosis for someone with a typical case? I've heard that the SARS, 2002, caused permanent lung damage in some cases, up to 15%, and they are seeing similar damage in some COVID-19 patients. Great question. First, we do not have a lot of data for long-term outcomes yet, as we have only known this virus has existed for about 3 months. Fortunately, the vast majority of people have mild illness, and I doubt that there will be long-term implications of infection these individuals, but of course remain curious and open-minded to emerging data on this front. People who survive critical illness from this infection, just like those who survive critical illness from any cause, are at risk for longer-term complications. Dr. Margat Haraj at the University of Toronto is a pioneer in this realm, and has published much of the Sentinel work. Example in the link below. https://www.name.org/10.1056/name001011802. Isaac Bogok, MD. What are the actual symptoms? Not just the initial gambit of flu-like symptoms but a full list of symptoms, progression of those symptoms through the life of the disease. How about all of the transmission methods? Thanks. This is a great question. The most common symptoms according to the WHO are fever, tiredness, and dry cough. There are some reports of aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. They seem to be mild and progress gradually, which seems somewhat different than flu, which can hit you like a ton of brick and cause rapid onset of symptoms, but again information is still evolving. Some people who are infected don't develop any symptoms and don't feel unwell at all. Most people, about 80%, recover without any specific treatment. For those that get severely ill, they can also have trouble breathing. At this time we know it can be transmitted through droplets when someone sneezes or coughs, especially within 6 feet of you. And these droplets can survive on surfaces, so touching your eye/nose/mouth after touching surface that is contaminated can also spread infection. There are also some reports of fecal transmission. Neha Pathak, MD. What Neha said. But since you asked, here are some specifics. This is from an analysis of 55,000 confirmed cases of COVID-19 in China. Symptoms include fever, 87.9%, dry cough, 67.7%, fatigue, 38.1%, sputum production, 33.4%, shortness of breath, 18.6%, sore throat, 13.9%, headache, 13.6%, myalgia or arthralgia, 14.8%, chills 11.4%, nausea or vomiting, 5.0%, nasal congestion, 4.8%, diarrhea, 3.7%, and hemoptysis, 0.9%, and conjunctival congestion, 0.8%. Here's the reference. Brenda Goodman, Is it possible to stay uninfected if a member of your household comes down with it, or is it inevitable? It is possible to stay uninfected. Yesterday in a press briefing, Dr. Nancy Messonnier at the CDC said that the secondary attack rate among family members of confirmed COVID-19 cases in the U.S. is 10.5% so far. So that means that about 1 in 10 family members who have been exposed by a relative have gotten sick. If your loved one gets sick, the advice I've seen from public health officials is to try to put a mask on them. That may be hard, given the scarcity of masks in the U.S. right now, and isolate them from others. The recommendation is to try to have them use their own bedroom and bathroom separately from the rest of the family. Of course, wash your hands and disinfect common contact surfaces frequently. Brenda Goodman. What is the latest news on how long the virus can survive on environmental surfaces? I read from the CDC about a week ago that it can live on copper and iron for about 2 hours, but my AHC notes in their preparation planning that the virus can stay active on surfaces for up to 7 days. Is there any recent breakthroughs in this regard? Should we be sanitizing every item we pick up from the grocery store? We don't have data yet for this particular virus. There are many factors that contribute to how long a virus will live on a surface, including temperature, humidity, the type of surface, etc. Many believe that in most circumstances, the virus can live for a couple of hours to a couple of days, depending on the surface and the environment around it. It is relatively easy to disinfect surfaces, and there is helpful information from reliable resources, such as the US CDC here. Isaac B. Will this end anytime soon, like in 2 to 3 years? Or we will get used to it? This remains an open question. It is possible, for instance, that the virus moves quickly across the globe and ultimately burns itself out. Or, this virus can become what we refer to as endemic and becomes a part of our normal repertoire of viruses we have to contend with each year. This was, for instance, the case with H1N1. The virus emerged in 2009 and spread across the globe, infecting many millions. Now, it has become part of the repertoire of viruses we expect to deal with each year, and vaccines are in development to help tackle the virus. Time will tell what course this particular virus takes. Michael Mina, MD, PhD. What is the best single piece of advice you can give to everyday people? For example, should we stock up and batten down the hatches? Should we carry on like nothing is happening? Most of the experts I've spoken to have emphasized that it's smart to plan for this. Our hospitals could quickly be overwhelmed if this infection spreads more widely. Adults are most vulnerable to infection. Seniors are at highest risk. They are advising that we think about how we would take care of family members if they got ill. If you're a parent taking care of young children, who are much less likely to get sick, who will take care of them if you get sick? If you need to see a doctor, what's the protocol for an office visit if you suspect you have COVID-19? Do you have enough of your prescription meds at home? It's not a bad idea to be thinking along those lines. And wash your hands. A lot. It protects you and others. Brenda Goodman. Thanks for hosting this. What is your personal expectation about future developments? Is there really a realistic chance to contain the virus? Which country did react the best? There is no real chance to stop the global spread at this point. The cat is out of the bag. However, we can all work to slow transmission and eventually halt global spread over time. Public health efforts are now turning attention to mitigation strategies, slowing spread, preventing illness, keeping healthcare facilities running, etc., rather than complete prevention of transmission. Singapore and Hong Kong have done good jobs at mitigating spread. China also has done an extraordinary job at attempting to mitigate spread. The speed with which China acted was remarkable. The virus began there, and thus China was at a severe disadvantage in terms of being able to mitigate spread. But it has acted swiftly to minimize onward transmission by going to extraordinary lengths such as quarantining whole cities. The world may have to make similar decisions to limit spread. Michael Mina, MD, PhD. Why should I worry or not worry? I see panic from some and total calm from others. I think it is important to 1. Take this seriously and stay aware of the global and local situation. 2. Be prepared. And 3. Of course, not panic. For many there are excellent local, for example at the city, state, province level, online resources that will let you know about what is happening with regards to the COVID-19 epidemic and response. Local public health websites tend to have good information on this. For a more global perspective, the WHO has a terrific website and even has a myth-busting section where some of the more alarmist or conspiracy theory type issues are addressed. Link below. Knowledge and preparation guided by quality data will alleviate fear, anxiety, and panic. Isaac Bogok, MD. Are asthmatics as much at risk as diabetes, heart disease patients? Even if the asthma is well controlled? There is still so much we don't know about this virus. I'm sure there's going to be a lot of research coming out in the weeks and months ahead that will delve into questions like this. I talked to Dr. Tom Frieden yesterday, former head of the CDC, and he talked about underlying conditions and the fact that people need to understand that it's not rare to have them. 60% of adults in the US have an underlying condition, which puts them at higher risk of infection and severity of infection. I haven't seen anything yet to suggest that one underlying condition is riskier, in terms of COVID-19, than another. Brenda Goodman.